In just the last 20 years, the rate of high blood pressure among children and teenagers has nearly doubled. This isn't a statistical fluke, it's a global review confirming a silent crisis. We're talking about 114 million young people under the age of 19 who are now living with hypertension. An additional 8.2% are already in the pre-hypertension danger zone, meaning their levels are elevated but haven't yet crossed the threshold. What is driving this alarming spike? Experts point directly to a toxic combination of poor diets, mass inactivity, and soaring levels of childhood obesity. This isn't just a kid problem that they will grow out of. Doctors are warning this is a public health emergency, setting millions of children on a path for lifelong cardiovascular disease, kidney failure, and stroke. How much does obesity really increase this risk? And what are pediatricians seeing on the front line that they once considered unheard of in children? The data is shocking. If you are a parent, a grandparent, or anyone concerned about the legacy we're leaving for the next generation, you are in the right place at Senior Stop. This profound warning comes from one of the largest reviews of its kind, a sweeping meta-analysis published in the Lancet Child and Adolescent Health. This wasn't a small, isolated study. Researchers analyzed data from 96 different studies involving over 400,000 children across 21 countries. The trend was undeniable and consistent. In the year 2000, roughly 3.2% of children globally had hypertension. By 2020, that figure had skyrocketed to 6.2%. Professor Igor Rudan, director of the Center for Global Health Research at Edinburgh University's Usher Institute, stated plainly, the nearly twofold increase in childhood high blood pressure over 20 years should raise alarm bells for healthcare providers and caregivers. These alarm bells are ringing because the immediate numbers are only part of the story. The 6.2%, 114 million children, are those who already meet the clinical definition of hypertension. But the study also flagged that 8.2% of children are pre-hypertensive. This group is teetering on the edge, with blood pressure levels high enough to be a serious concern and a strong predictor of progressing to full-blown hypertension. This pre-hypertension is especially rampant during adolescence. The review noted that while about 7% of younger children fall into this category, the rate jumps to nearly 11.8% among teenagers. Doctors identified a critical and dangerous window, finding that blood pressure levels tend to rise sharply in early adolescence, often peaking around the age of 14, particularly among boys. This highlights a crucial period where intervention and screening are absolutely vital. Yet it's often the time when children's habits, diet and activity, are most difficult to manage. So what is the engine driving this catastrophic trend? The review leaves no room for doubt. Obesity was identified as the substantial driver. The numbers here are staggering. The analysis found that nearly 19% of children and teenagers living with obesity were affected by high blood pressure. Compare that to children considered to be a healthy weight. Fewer than 3% had the condition. This means a child with obesity is more than 6 times likely to develop high blood pressure than their healthy weight peers. This is not a coincidence, it's a direct biological consequence. When a body carries excess weight, the heart is forced to pump harder to supply blood to the larger body mass. This increased workload directly raises blood pressure. Furthermore, obesity is linked to a cascade of other issues, including insulin resistance, inflammation, and hormonal changes, all of which contribute to the hardening and narrowing of arteries, forcing the heart to work even harder. It's a vicious cycle that begins in childhood. Dr. Paige Song of Zhejiang University School of Medicine, a study author, emphasized that this uptick is driven largely by lifestyle factors. These factors are the other two parts of the toxic combination: unhealthy diets and decreased physical activity. We are quite simply in the midst of a global shift in how children live, eat, and play. The unhealthy diets mentioned are not just about the occasional treat. They represent a fundamental change in nutrition. We've moved toward a diet dominated by ultra-processed foods, which are calorie-dense but nutrient-poor. These foods are scientifically engineered to be hyperpalatable and are loaded with two of the biggest culprits for hypertension, sodium and sugar. Excessive salt intake, often hidden in packaged snacks, frozen meals, and fast food, causes the body to retain water, which increases blood volume and, consequently, blood pressure. High sugar intake, especially from sugary drinks and cereals, contributes directly to weight gain and obesity, fueling the primary driver of hypertension. The second factor, decreased physical activity, is inextricably linked to the rise of sedentary behaviors, most notably excessive screen time. Where previous generations spent their afternoons running, climbing, and playing outdoors, the current generation's leisure time is overwhelmingly dominated by phones, tablets, and gaming consoles. This mass inactivity means children are not burning the calories they consume, leading directly to the obesity epidemic that in turn fuels the hypertension crisis. This data is not just an abstract projection, it is a reality that pediatricians are witnessing every single day. Professor Steve Turner, president of the Royal College of Pediatrics and Child Health, confirmed that these findings mirror what pediatricians are seeing on the front line. He painted a deeply concerning picture of the modern child's health profile. He warned that children are presenting not only with hypertension, but also other serious conditions linked to this crisis. The most shocking of these is type 2 diabetes. For generations, type 2 diabetes was known exclusively as adult-onset diabetes. It was a disease of lifestyle that took decades of poor habits to develop. Today, pediatricians are treating it regularly. This shift is a direct result of the same obesity and inactivity crisis driving high blood pressure. But the list doesn't stop there. Professor Turner also cited asthma and mental health problems as serious conditions linked to this crisis. The link between obesity and asthma is complex, involving both the physical restriction of the lungs by excess weight and the systemic inflammation that obesity causes. The mental toll, stemming from bullying, low self-esteem, and the social isolation associated with obesity and chronic illness, adds another layer of suffering for these children.
Professor Turner did not mince words about the ultimate cost. We know that persistent hypertension is a risk factor for an early death due to damage to the cardiovascular system and other organs, he stated. Healthy children grow into healthy adults, but with trends like these, I fear that without urgent action, we are hurtling towards a public health emergency. This is the core of the crisis. High blood pressure in a 14-year-old is not the same as it is in a 64-year-old. When hypertension begins in childhood, it inflicts damage on the body for decades longer than it otherwise would have. Professor Brian Williams, the Chief Scientific and Medical Officer of the British Heart Foundation, articulated this precise danger. Elevated blood pressure in childhood often persists into adulthood, increasing the risk of heart disease and stroke later in life. This persistence is the problem. The condition doesn't just vanish. A teenager with high blood pressure is, in most cases, an adult with high blood pressure. This means the disease gets a multi-decade head start on destroying the body. The damage is slow, silent, and systemic. On the heart, the constant high pressure forces the heart muscle to thicken and stiffen, reducing its efficiency and leading to heart failure. On the arteries, it accelerates atherosclerosis, the hardening and narrowing of arteries throughout the entire body. This process, which should take a lifetime, is now beginning before a person even graduates high school. On the brain, damaged and narrowed arteries in the brain are the primary cause of strokes, a devastating event that is now a tangible risk for these children in their 30s and 40s instead of their 60s and 70s. On the kidneys, the delicate filtering vessels in the kidneys are destroyed by sustained high pressure, leading to chronic kidney disease and, eventually, the need for dialysis or a transplant. This is the lifelong harm experts are warning about. We are witnessing the creation of an entire generation that will be sicker and may live shorter lives than their parents, burdened by chronic diseases that were once preventable. This picture is grim, but it is not without hope. The experts who raised the alarm are also the ones charting the path forward. This crisis is man-made, and its solutions are within our grasp. The approach must be twofold: action at the family level and action at the societal level. Dr. Paige Song, the study's author, stressed that parents and caregivers have a pivotal role in prevention and management. Her recommendations are a return to the fundamentals of health. First, promoting healthy habits. This means a balanced diet rich in fruits, vegetables, and whole grains while minimizing salt and sugar intake. For families, this translates into actionable steps: reading nutrition labels to check for sodium, swapping sugary sodas and juices for water, and prioritizing home-cooked meals over processed or fast food. Second, encouraging regular physical activity. This is the direct antidote to a sedentary lifestyle. It must be paired with limiting sedentary behaviors, such as excessive screen time. This is perhaps the most difficult challenge for modern parents, but it is non-negotiable for reversing this trend. Third, monitoring and early detection. Dr. Song strongly recommends regular blood pressure monitoring for children for families with a history of hypertension. This can be done at home. Early detection of elevated blood pressure is the key to mitigating long-term complications before they become irreversible. Professor Williams of the British Heart Foundation added a crucial ray of hope. The damage is not necessarily permanent. He noted that the good news is that obesity-related high blood pressure can be reversed. A change in lifestyle, a healthier diet, weight loss, and regular exercise can, in many cases, bring blood pressure back down to a healthy range and stop the damage from accumulating. However, placing the burden entirely on families is not enough. Experts agree that bold action is needed from governments to address the environment that makes being unhealthy the default choice. Professor Williams called for expanding restrictions on the marketing of unhealthy products. Children are relentlessly targeted with advertisements for high sugar, high salt, and high fat foods. We must explore further measures to drive the food industry to make our everyday foods healthier. This includes policies like front-of-pack nutritional labeling, sugar taxes, and mandating lower sodium levels in processed foods. This is a public health emergency that demands a public health response. It requires making healthy school lunches a priority, designing communities with safe parks and sidewalks to encourage activity, and holding the food industry accountable for its role in this epidemic. We are at a crossroads. We have 114 million children already on a dangerous path, and millions more right behind them. This global review is not a prediction. It is a snapshot of a crisis that is already here. The alarm bells are ringing. The challenge for our generation, for us as parents and grandparents, is to recognize that the health of the next generation is our legacy. We must act at home, and we must demand action from our leaders to stop this trend and give our children the healthy future they deserve. What actions are you taking in your own family? Share your thoughts in the comments below. And if you believe this information is vital for the health of our children, make sure you're subscribed to Senior Stop.